This is a short PowerPoint on inhaled medications. Inhaled medications are sort of like topical medications delivered directly to the lungs. If you don't have to swallow meds and they don't go through your GI system and the liver first pass effect, etc., you can deliver a smaller amount of medication and it will be effective. The other thing is that your lungs are so vascular. When you inhale the medication into your lungs, it immediately goes into your bloodstream. So it's close to an IV. I mean, really, you inhale it and it immediately goes into your bloodstream. So it works very quickly. This does a number of things. It minimizes systemic side effects, especially for corticosteroids. Anytime, if you recall, that you take oral corticosteroids, you have a laundry list of side effects and they cause a whole lot of problems, whereas if you inhale them, the side effects are much, much less and the dosage of medication you take is much less. You can use a spacer to inhale the medication from a metered dose inhaler, and that makes them more effective. By the way, MDI stands for metered dose inhaler. There are lots of different medications that come through metered dose inhalers. The ones that you will be using most often are bronchodilators, corticosteroids, sometimes combinations of bronchodilators and corticosteroids, and then mast cell inhibitors. There are so many different types of inhalers. Some use propellants to deliver the medications. Some are dry powders, almost like a little pill that you put in there, and it is a powder that you inhale. It's lots and lots of different delivery systems that you can inhale. So the big thing is that you need to read the directions, and so that you know how it works, and then the teaching that you give to your patient is critical. Two things you need to teach: how to use the inhaler, huge thing, and when to use which inhaler, because quite often these people are on different inhalers. Some of them are rescue inhalers, like the short-acting beta agonists such as albuterol, and it's important to know when to use those as opposed to when to use your inhaled corticosteroid. That's a maintenance medication and it's not going to do any good in an acute asthma attack. And so this is one instance when patient teaching is a very, very critical part of taking the medication. Here are some pictures of a number of different inhalers that are on the market. The one on the top left is the one that you're probably most familiar with. It's the medication that is delivered with via a propellant that is inside a pressurized canister. The one on the top right is an inhaled powder, as is the one down below, the Advair Discus. It's if you look at them, they look different, but they all three do the same thing. They all three deliver medication directly into your lungs by inhaling, and then that goes directly into your bloodstream. This is the metered dose inhaler spacer that I talked about. If you recall from pharmacology, it really takes a lot of thinking about and practicing to properly use a metered dose inhaler. And it's something that you can really never be sure people will do correctly all the time because there's so much timing involved and aiming the inhaler at the right angle and so many different things involved in doing this correctly. But if you put a spacer, which is basically just a tube that has two openings, one opening that you put the inhaler in and the other opening that you put in your mouth, then when you squeeze the inhaler to deliver the dose goes into the spacer, and then the person can take their deep breath and get their medication through the spacer. So there's not the trick of timing, squeezing the inhaler and inhaling at the same time. You can just squeeze it and then inhale on your own time, and there's not that coordination involved. And so usually works very well with kids. A lot of adults use it. It's just a very efficient way to deliver the drug. Nebulizers are another way to deliver inhaled medication directly to the lungs. It's the same principle as a metered dose inhaler. You can deliver smaller doses of a drug and eliminate a lot of the systemic side effects that you would have if you took the drug by mouth. There are nebulized bronchodilators, nebulized corticosteroids. You can have a single drug, like a nebulized albuterol. You can have a combination drug. There's a drug called Duoneb that has two different bronchodilators in it, a long-acting beta agonist and an anticholinergic. There are people who use these at home daily for a number of different reasons, or they really come in handy for exacerbations of asthma or COPD. They are a little bit more efficient way of making sure you get a good amount of drug delivered deep into the lungs. The people who use them daily do it for many different reasons. If you think about people who may not be well suited for a metered dose inhaler, a baby, for instance, no way a baby's going to take a metered dose inhaler, but you can hold a mask up or do a blow-by. Someone with a tracheostomy, someone who either has lost the use of their hands or has trouble with grip strength and fine motor skills. Lots of different reasons why people will do better on a nebulizer than they will with a metered dose inhaler. I know that you talked about nebulizers in your MedPass skills lab, but I just want to go over it a little bit here too. Lots of different kinds of nebulizers, lots of different styles. Very small battery-powered portable nebulizers are available so that you can really use them on the go. And then there's also the larger nebulizers that you plug in that people most of the time will use at home. You can use one with a mouthpiece, like in the upper left-hand corner, and just put the mouthpiece in your mouth. You can use a mask and put the whole mask on your face. You can use a trach mask that's very similar to an oxygen trach mask. They have small mouthpieces for babies. There's a lot of different ways that you can deliver nebulized medication. And if you recall, the medication comes in a liquid. You put it in the nebulizer cup, and then compressed air is used to aerosolize that liquid into teeny tiny little drops, which the person then inhales, and the medication is delivered directly into the alveoli and then crosses into the capillaries and into the patient's bloodstream.